Welcome back. Thanks for staying on with us. I have with me Jan of KRI and Dr. Khairia of USM talking about their research, very, very aptly named, called Dancing with COVID-19. And this is when we talk about the projections of the public health system when we are easing up on the MCO, which ironically begins today. So the research is very timely when we talk about the research on how to live with COVID-19 the moment it ends, and this is where the analysis comes in. So both of you, I want to throw the question to either of you, just pick it up. How are we dancing with COVID-19 right now?
So I guess maybe we'll explain a bit on how we actually did the projections. So the methods that we took is a mathematical model or an epidemiological model called the augmented SCIR model. And what a model does is basically it takes all the information that we have available today and allows us to use mathematical equations to project what might happen in the future. And to do that, to be able to project into the future, we need to make sure that our baseline model actually matches what we call the ground truth, which is the data of the Malaysian epidemic as we know it. So if by that logic, what we're seeing with the current trend is that it is in fact showing what we could call a more flattened curve. So we're dancing with it quite well, I think. But of course, we have the MCO, which is ensuring a majority of the Malaysian population is staying well at home. But in the future, as you're saying that we're going to be easing up on these restrictions, a lot of people possibly will be back out and about. What our model is saying that there are two main things that we need to be wary of that will change the trend of the transmission. So one thing is the effectiveness of a general preventive behavior interventions. So that is the type of things that we do to prevent people from getting infected in the first place. And then the other one is our isolation intervention effectiveness. So that is how well we act to be able to isolate people who are infected to prevent them from infecting others. So those two things is what we play around with to see whether or not any changes in effectiveness will affect our COVID-19 transmission in the future. And what that model is telling us right now is that there is a margin where the ease in restrictions will not necessarily cause another wave, but that room or that margin is fairly modest. So we need to err on the side of caution, and we would say have a cautious tango with COVID-19 and maintain as much of the public health precautions that we've been maintaining under the MCO to be able to avoid another outbreak.
The Jan, you want to add or
yeah.
Yeah.
So just to reiterate that the model shows us that isolation effectiveness is important. The model is quite sensitive to that, which tells us that yes, testing capacity is important, but what we do moving forward is also important. Like for example, businesses and organizations making sure that your employees can isolate themselves if they're not feeling well becomes important, because isolation effectiveness is important, and at an individual level that personal responsibility is also very important.
The thing about the press statements that have been coming out by the Director General of Health, it's been 3 days now, he's been saying the same thing, which is just because PKPB is announced at 4th of May doesn't mean that everybody should rush out the gates and off you go, everybody goes back to normal. No, he's saying that this is just to allow for businesses to reorient themselves. The examples he used, like stock taking, for instance, or alternating between, if you have 10 employees, 5 comes to work, sort themselves out, go back the next day, another 5 comes to work, something like that. He's basically saying that this is an opportunity for people, if they really need to get out, then they can get out. The words he used, things like the safest place on earth for us right now is still at home. He's saying to us, use digital methods to get around work, exactly what we're doing now, Skype interviews, for instance, as opposed to face to face. He's saying things like isolation still wins the day. Don't shake hands. Wash our hands 5 times a day. That kind of thing, right? It's basically the new normal, and this is what new normal looks like for us. How serious should we take his suggestions, or are we really, saying everything's okay, let's go back to our normal ways? How serious is it right now in order for us to move forward in terms of isolating ourselves from others versus going back to how things were, in February or January this year?
Yeah. I think what we need to, I think that's basically the key here. What we do from this point on is going to determine what's going to happen in the next few months. And as we mentioned before, like we know that there are public health precautions that we can take to reduce the risk of getting infected. And so those are your things like hand washing, wearing a mask when you go out, wearing it properly for one. And also just reducing your movement outside of the home, which is where it's basically your safe bubble, right? So people need to start adopting a more conscious approach in what they do. If they think really hard, do they need to go out? If they need to go out, can they time it so that they can avoid crowds? Also, when they go out, do they need to bring things to prevent themselves from getting infected? And I think a key thing here is once people are allowed to go out, I mean, there have been people who've been going out probably once a week to do groceries. They are more familiar of what's awaiting out there. But there'll be people like children who don't know that there's a new world waiting for them. So we need to ask, are they ready? And this is why I think treating this period as an adaptation period is quite important. Use this to train everybody to be on board. And our report touches on employers, businesses, schools, households, individuals, really everybody to think very hard, what can they do to reduce the risk for themselves and their community? So yeah, it is the new normal and it's very important.
Yeah, just to add, if you want to conceptualize it, like I said, it is we've been living in a bubble. Individually, in terms of our household, we've been living in a safe bubble, generally a safe bubble, and behavior does need to change for us to be able to control the disease moving forward. How do we do that? So it's taking this time for you to conceptualize, like I said, how do you do the next step on your everyday life? And so, for example, you can therefore possibly go see your grandparents or parents moving forward. But should you? Is that the safest thing for them? Because you want to keep them safe in their own bubble and not encroach on that unnecessarily because you love them. You want to keep them safe. So essentially, that's the message that needs to go out. It's finding ways to change your own behavior. We recognize that behavioral change is very hard. I think I will explain that from a public health perspective, what the literature tells us about that. But that's the only way that we can move forward on this.
The issue is also on regulatory bodies and state actors. Up until yesterday, I suppose, everybody seems to be concerted into how they are going to deal with this. KKM says it, and then the federal government, disseminates it, and everyone follows sings to the same tune. But as we started off this interview, we started saying things like 8 states thus far. We don't know how many more states are going to react on this, but so far 8 states have announced that they are not going to introduce PKPB or conditional MCO. Does this complicate things further in terms of how things are going to be done? Because states are doing one thing, federal government is doing another thing. Or do you think that this is just teething issues into how we are going to roll out life after MCO?
Yeah, I think it's a big change, and everyone recognizes that this is a big change. Unfortunately, our model doesn't go into the granularity of state level information, but our model does show, we've our model does show that there are things that does differentiate states. For example, geography and hospital capacity does in fact affect the transmission rates or controlling the transmission at a state level. So um, there is considerations, but either way, it's not an easy decision. Yeah.
And if I could add to that, as Jan says, in public health, behavior interventions are the hardest thing for us to get compliance on, because people are different, people have different needs, they're unpredictable. And if you talk about it on a national level, you've got the states, you've got all the organizations, all the schools, all of them have different needs and they have different modes of operation, and all of that needs to change. And so there's a lot of thought that needs to go in there. And I think it's a good thing that states are actually thinking about what is the right thing to do for their state, especially because for now we still have limited movement between states. So states are in effect their own bubble as well. But I think moving forward, whatever the decision is, there has to be consistency and clarity of expectations from the highest level to the lowest level in the community. Communication, reminders, signs, so that people are all on the same page, so that people don't need to overinterpret what is the right thing to do. I think that will put more ease and more confidence on people to move forward in the new norm. But as long as there's too many questions about what can I do, what can I not do in the public sphere, that's when you're still going to have some anxiety, and it's going to be harder to move together. So I think communication.
You're on the right path here, because there's a lot of operational questions that people are asking. Can I do this? Can I do that? What about this sector and that sector? And then they give us this thick of an SOP, and we're supposed to see through it. The simple thing, right? I mean, my own Tasca, I have a 6-year-old, 7-year-old girl here that I want to send to the Tasca, and there's a debate about how are we going to sort this one out, right? But it goes without saying that this is something that we all have to deal with, this whole megaton pages of SOPs. But the essential thing here is to use logic. It's just to use our common sense on the way forward. And I'm sure the police and whoever else, KKM or whoever else, right, they're trying to work this out with us as well. And this is just people like you and me. We haven't spoken about trade, about exports and importing stuff and all the other stuff. But we have to draw this conversation to a close. If you guys have 2 or 3 things that you want to share from the report that the public can take and understand, and I'm sure that while many others are rushing, opening out their browsers trying to download this fantastic report of yours, there are many others that are going to say, after this show is over, I'm probably not going to read more about this issue. For those guys, what would be the 2 or 3 things that you can share with them about this report moving forward?
Actually, knowing that the frontliners are constantly risking their health and their lives, and I think, Yem, you know very well, and their families' well-being, making these changes are hard.
See, that's coded because my wife is a frontliner. She's dealing with stuff at the hospital Selayang. Yes. So for those people that were in this speak, yes. My wife is also dealing with patients at COVID-19 hospital, which is Hospital Selayang. But yes, go on.
Yes. So I think, you are very aware of that. Keeping that in mind, the changes that we have are hard. And the things that we used to do or take for granted before COVID-19 are now, to a certain extent, is a luxury. We do need to have a 33 million players in Team Malaysia to play our part the best we can. Hashtag kita jaga kita. Kai, do you want to add?
Yeah, and I think like as Jan says, it's going to be a team effort. We're going to need to constantly communicate and support each other, because we have a very small room to move forward safely until we get a vaccine. But with difficulty, usually there is ease, and there's so many people working on this, and vaccines may be on the horizon, and we want to be able to keep as many people safe as possible until that comes. And so this is our sacrifice to make sure that our frontliners are protected, our vulnerable populations are protected, and if it means not going out to eat for a few months, I think that's the sacrifice that we'll have to make. It's a real important time to ask what is really important to us.
Yeah, I think those two messages are very interesting. You know, Team Malaysia 33 million, as well as, is it really that important? You know, I mean, but you know, I mean, essentially we need to keep on communicating with each other to make sure that everybody is aware of the situation right now. Nobody's going to take this seriously. Nobody's going to take this lightly, pardon me. And you know, when you benchmark Malaysia against other countries like US, for instance, it's crazy how you have those people there that you know, taking this very weirdly and not taking this seriously, despite 2,000, 3,000 deaths per day. And anyway, thanks for taking the time to speak with me. That was a very enlightening conversation. Of course, if you've been watching this show and you want to read more, just head on to the KRI website. You can download the report from there, I suppose, right? It's for public viewing. Right, you don't have to pay for it. I've been speaking with Iruna Jan of Khazanah Research Institute, and of course Dr. Khairia Hanafia. I'm calling in all the way from Penang. Thanks again, ladies, for taking time to speak with us. If you've missed any part of this show, just head on to astroawani.com, look for Notepad over there. You can also find these kind of interviews on our mobile app. Just download the Astro AWANI application wherever you get the app. Until then, thanks very much for watching. Let's catch you the next time.